it's extraordinarily important during the time of a pandemic to remember the principles of palliative care. And so when many people think about palliative care, they think about end-of-life care or, a really sad or difficult topic to talk about. But what we discuss in our article is reminding people that palliative care actually comes in two different versions or flavors. First, what we call primary or foundational palliative care. In primary palliative care, we really discuss the idea that all clinicians in healthcare have a foundational responsibility to provide exquisite care focused on patients' suffering, no matter who they are or where they are. And that for some patients, they need an extra layer of support, which we discuss, where integrating the role of specialty palliative care teams ends up being super important. Hi, I'm Dr. Arif Kamal, Associate Professor of Medicine at Duke University. And on behalf of my colleagues, Dr. David Casseret and Dr. Diane Meyer, I want to talk about compassion in a crisis, the role of palliative care during the COVID-19 pandemic, in an upcoming version of the Mayo Clinic proceedings. Palliative care in this time is as important as it ever has been before. And we particularly pointed this out during the time of the pandemic when there's high uncertainty and complexity. Uncertainty as it relates to prognosis and am I going to get this? Is my caregivers going to get this? Are people I love going to be affected by this in some way? Those are the health uncertainties, but certainly there's social and financial uncertainties as well. Can I leave my house? Is it safe to be around other people? Will I still have a job, et cetera? And as we know, those social determinants affect how people do in their own healthcare. There's also the uncertainty that relates with just the future of our world and our society in general. As it turns out, people don't love a lot of uncertainty, and dealing with that requires careful conversations, and that's all part of what we call exquisite palliative care. That means as healthcare clinicians, we talk to patients about things that are on their mind, the things they're worried about and hopeful for, and how that impacts their health becomes an increasingly important conversation that we should all be having, particularly to talk to patients and caregivers about the uncertainty, but also help them navigate through the complexity that exists. We recognize that a lot of people's worlds are upside down because of the pandemic, and all that anxiety and stress needs some avenue to be able to talk through. Also, we recognize with up to close to 200,000 deaths in the United States, that we have to have very careful conversations about patients' preferences and values, how they want to be taken care of if they do fall very ill. And importantly, how their caregivers and others around them can deal with that, because it's obviously a very difficult thing to have to go through. So our overall findings are really that palliative care at a time where there may be so much focus now on ICU care and emergency room care and so on becomes a critical component of the fabric of healthcare. And what we also worry about as authors is that over time, as financial constraints start affecting healthcare systems, just because of the overall economy and so on, that services like palliative care, which may not be really revenue producing services, meaning that they're not surgeries and other things that bring in lots of money, are still extraordinarily important to keep within health systems because they help them plan not only for this pandemic, but for also other uncertainties that may come along the pike. So how do we believe this relates to clinical practice? Well, it's very clear that palliative care programs now need to be flexed. They need to be built upon and greater weaved into the fabric of everyday healthcare settings where the pandemic care is happening. So you can imagine that palliative care can help man phone banks, right? So that as worried patients and caregivers are calling health systems, that palliative care folks can talk to them about sort of the worries that they're having and how to plan for a future that may be a bit uncertain. You can also imagine that palliative care clinicians can really help in emergency departments, right? As patients and caregivers come in with different concerns or they're getting really sick very quickly, that palliative care can be there to help talk about how to manage their symptoms, think about what's important to them, and who else should be involved, and get those things in place really early and often. And then lastly, palliative care in more of a planning stance can help health systems think about all the different social determinants of health. So for example, we think about where do patients live and what are their job statuses and how is their financial situation and other components that we know affects how they deal with health in general, but also particularly in a pandemic. So for example, a core component of palliative care is understanding what gives a person hope and drive. Particularly when things are complex and uncertain, we want to know as palliative care clinicians, what makes you tick, what gives you strength, and what are those things we want to make sure are still around so that you can deal with the thing that's in front of us. So for example, some people pull strength from spirituality and religion. And that's an important component of what we ask when we're talking to patients. So that if we recognize that's important, we figure out how to bring that high touch religious or spiritual care, if that's what they need, into the care that they're receiving, for example, in the ICU. So I think fundamentally what this means in terms of planning for the future is really leaning into palliative care, recognizing it's not just end of life care, it's really about planning. Oftentimes we say that it's providing an extra layer of support for patients where we want to hope for the best and plan for the rest. And if anything, the pandemic reminds us that the rest can be a large slew of things that could happen. And planning for that is really fundamentally the role of palliative care, and a reason that we believe it brings that extra layer of compassion in the middle of the pandemic.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.